I'm sure you've seen quality marks on all kinds of products that tell you that they've been tested carefully and are reliable, and it's much the same for health information. There are organisations whose role is to look at information that's being put up on the web and determine whether it is reliable, whether it is up to date, and whether you can trust it when you're looking for information for your healthcare needs. So the aims of this presentation will be to give you some advice on navigating what has become known as the infodemic of health information. And what we mean by this is the fact that there is just so much information available online at the moment. And I can show you very quickly, if we come out of here and go onto my search engine. This site, Internet Live Statistics, literally monitors activity across the World Wide Web on a second-by-second basis. So you can see these numbers just ticking up all the time, and the total number of websites. And as you can see, that is just increasing as I speak. So how, amongst all of those websites, are you going to find information that you really want to trust for your healthcare needs? So when I talk about the infodemic, this is what I mean. There's just so much out there that even professional evidence specialists whose full-time job is to search the web looking for reliable information, even we find it hard to keep up with the evidence on the web. So we're going to learn about the health quality marks, and we're going to have a look at a couple of health information websites, and I'll show you where you find these quality marks when you're looking at websites. Okay, so very often when either we feel like we have some symptoms of an illness, or we're not feeling quite well, or possibly even after we've been to see a GP or a doctor at the hospital, our first thing to do is to Google it. We know we feel a bit unwell, let's Google those symptoms and see what's going on. And as I've shown you, I mean, Google is a fabulous tool. There is so much information on the World Wide Web, and we're very lucky these days that at our fingertips we can access this information, but there is an awful lot of information, and some of it is misinformation. Now that just means information that's not accurate. It hasn't been designed deliberately to mislead you, but it might be based on rumor, it might be speculation. It's just not clinically accurate. Worse than that, there is a lot of disinformation on the web. People deliberately spreading false messages, false information. And we don't want to be looking at that when we think that we might be either suffering from an illness or looking for good advice to improve our health and to take care of our health. There's a lot of speculation, and there's also a lot of information which looks as if it's valid information, but is actually quite cleverly disguised marketing information. And the further you read, the more you realize that actually they really just want you to buy their products, and they're not necessarily giving you the best possible information for your healthcare needs. So how do we decide whether a website has advice that is useful for our own healthcare information? One of the ways we can do this is to look for the health quality marks. There are other ways, and there will be further videos to explain those, but today we're just looking at health quality marks. Okay, so for a website, for a health information website to display a quality mark, the information on that website has to have undergone rigorous assessment. It will have to have been tested by both health professionals, so doctors, nurses, physiotherapists, clinical researchers, whether they're in hospitals or in academic institutions. And also it has been tested by end users, members of the public, people who are going to need that information, and they will test it to make sure that the information is clear and reasoned and is presented in ways that can be understood by the majority of the population. They will be checking that the information is evidence-based. And what we mean by that is it has been tested under clinical test conditions. So it's evidence that has emerged from clinical studies and from repeated clinical studies, so that we can say that on balance, this information is reliable. And as I just referred to a bit earlier, it has to be suitably presented for the end user. So, you know, there will be pictures, there will be infographics, there might even be short videos, and the information will be laid out very clearly, very logically, so that you can understand what it's telling you. So if we move on to the health quality marks, the first one we're going to talk about is what we call the PIF tick. Okay, it comes from the Patient Information Forum, so PIF, and they were an organisation. It's a completely independent organisation established by the King's Fund, which again is an independent healthcare, non-profit healthcare institution, organisation, think tank that created the Patient Information Forum. And last year, 2020, this was the PIF tick was became the UK quality mark, the quality mark for UK organisations to apply for their health information sites. And it replaced an old quality mark which had been developed by the National Health Service, and we will talk about this one later in the presentation, the TIS, the information standard it was called, but PIF has taken over from the NHS quality mark. And if I just click on the picture there, this just takes you into the PIF website, and you can explore this if you want to, but it basically will give you all the information about this organisation, about who's involved in the organisation, and it takes you through the criteria for trustworthy health information. So you can see all the checks and assessments that are used when the PIF tick is awarded to a site. Okay. Now I'm recording this video in June so that it would be ready for you to watch in July during Health Information Week. And I do understand from the PIF blog here that they are going to launch, during the week that you're watching this, they are going to launch a new public-facing website designed for people who are looking for health information. And on that website, there will be a directory of all of the organisations who are already accredited with the PIF tick. So you will be able to go to that website, you'll be able to look through their list and find health organisations that have been awarded this quality mark. So that will help you when you're looking for reliable health information. Okay, so public-facing site is being launched this week during Health Information Week. I can't show it to you in this presentation, but you will be able to look for that anytime from now. Okay, and here we go. This is the Macmillan Cancer Support website. They already have their accreditation with PIF. So I'm just going to scroll through, and you know, it strikes you straight away when you look at this site. It's beautifully designed. very clear, clearly spaced information. You know exactly where to find the different levels of information that you want. And if I scroll all the way to the bottom, down here, that is the PIF tick, okay? And if you click on it, it will actually then take you back to the PIF website so that you know it's the genuine quality mark. Right, so that's PIF. And we'll now move on to the sort of American equivalent, which is known as the OnCode, the Health on the Net certification, which has been designed, was originally designed for websites in the same way as PIF, but is also now awarding certification to web apps, because we all know that apps have become very popular. I certainly have a phone that's probably overloaded with apps because it's a great way of accessing information on the move. So the Health on the Net certification is now being applied to health information apps as well, which is obviously very useful. And if I click and take you to their website, you'll see in a very similar way to PIF, it's a not-for-profit organisation. It's promoting transparent and reliable health information online. And again, this is an organisation that is staffed by clinicians, by members of the community, and you can rest assured that any health information website that displays the OnCode certification will also have been very rigorously assessed for making sure that the information is reliable, that it is evidence-based, that it is up-to-date, that it's a safe website, and that end users have also found the information on there easy to understand. So they have more than 8,000 health organisations that have been awarded their certification. So if I go back to my presentation, here's one, and this is, I believe this is the most widely consulted source of health information on the web. It's an American organisation, so obviously it's got the American population, which is much larger than ours, clicking onto it every day to look for health information. But if we just have a quick look, WebMD, so you can find information here about any health condition, about drugs that you might be taking, about supplements that you might want to take, advice about living healthily, advice about pregnancy, and then sort of latest news and updates, plenty about COVID, which is obviously something that has concerned all of us over the last year. And if we scroll again, I'm going to just scroll down to the bottom. I hope I'm not scrolling too quickly for you. But here at the bottom, we can see it has the OnCode certification. Okay. And that doesn't take us. Yep, that takes us to the OnCode website. And again, we've got the certification, and also it tells you how long their certification is valid for. So it's well worth always just checking, making sure that their certification is still valid. Obviously that one still is, so we know it's a reliable site. Right, I mentioned a little bit earlier, the original standard, the original quality mark was the NHS information standard, which was just known as the information standard, or TIS for short. Okay, now there are still some sites, particularly in the UK, that will be still showing the TIS quality mark. And although this certification ended in July 2019, no further sites were awarded the mark after July 2019. Obviously, sites who had their certification awarded prior to that are still showing their certificates because they were valid for 3 years. And the reason for the constant revalidation is to make sure that information is up to date, because one thing we all know from healthcare is that things do change. Further studies occur, and health information is updated and should be updated frequently. So you will find that there are still some sites who were awarded their validation before July 2019. Those certificates, the very last ones, will expire by July 2022. So after July 2022, no site should be still displaying this quality mark. But any site that has it on now, and that was certified before July 2019, the information will still be up to date enough. And so here is an example, Allergy UK, something that I know probably concerns quite a large number of people as we finally get a British summer. Lots of information on this site about coping with all sorts of allergies, but in particular, people might want to be finding out information about hay fever at the moment, and fact sheets that will help you get through the days, explanations about what hay fever is, what causes it, and I know that there's some information here, yes, about the medications that you can use and ideas for trying to reduce the effect of hay fever on your day-to-day life. Okay, and I'm scrolling down to the bottom again because I want to show you that quality mark there, health and care information you can trust, the information standard. Okay, so that is the old National Health quality mark. All right, and as I say, that site will remain, or that certification will remain valid until July 2022 at the latest, and presumably this organisation will be applying for a PIF mark, and that TIS will be replaced with a PIF standard. Okay, so let's go back to the presentation. Those are the references that I've used throughout the presentation. I hope that has given you an insight into one way that you can be sure that information that you consult online to take care of your own good health or to manage health symptoms that you might have, this is one way that you can be sure that the information you're looking at is reliable and trustworthy. So good luck with your information searching, and remember to try to look out for the health quality marks.